Session on child and adolescent. I want to welcome everyone to today's session on child and adolescent poisoning, sponsored by the Children's Safety Network. If we move to the next slide. This session is sponsored by the Health Resources and Services Administration, HRSA, the U.S. Department of Health and Human Services, under the Child and Adolescent Injury and Violence Prevention Resource Centers Cooperative Agreement. So they're great partners, I know, with the Poison Centers. They're great partners with the Children's Safety Network. And so we're excited to have them be the sponsor here for this event. Before I move forward, again, my name is Richard Fogelson. We'll introduce myself and the speakers shortly. But just to get us moving, let me send it over to Kristen for some technical tips, and then we'll go into all the content. So Kristen, let me send it to you.
Hello, everyone. Welcome. Just a couple technical tips before we get started today. So we ask that you join audio via your computer if possible. And if you experience any audio issues, please dial a phone number found in the Zoom invitation and mute your computer speakers. You are muted and you will not be able to unmute yourself throughout the webinar. Same for your video. And if you have any questions at all, you can use the Q&A button found at the bottom of your screen to ask questions. This session is being recorded, and the recording will be posted along with the slides to our website within 1 week of today. And if you are in need of captions, you can click the little more icon at the bottom of your screen and click the captions icon to turn on automatic captions. And throughout the webinar, we will be sharing resource files and links in the chat. And I'm going to punt it back to Richard.
Great, thanks, Kristen. So again, my name is Richard Fogelson. I'm the Chief Executive Officer for America's Poison Centers. We represent the 55 poison centers across the United States and its territories, providing 24/7, 365 support to the public, to healthcare providers, to hospitals around poison and toxic exposures. So I am thrilled today to be able to introduce our two speakers, Dr. Kaitlyn Brown and Deirdre George Davis. So I'll start with Dr. Brown. Dr. Brown is a diplomat of the American Board of Applied Toxicology. She's the clinical managing director for America's Poison Centers. In this role, she leads the National Poison Data System surveillance and all the data analysis work as we kind of look at data in real time across the country. She also manages the relationships with the public health and industry partners. Dr. Brown previously also spent 6 years providing on-the-ground clinical toxicology and regional poison center leadership at one of our poison centers. So we're thrilled to have her at the national level. And Dr. Brown completed her PharmD and, again, clinical toxicology fellowship. So welcome to Dr. Brown. And then Deirdre George Davis is the community and education and outreach manager for the Indiana Poison Centers. She has over 20 years of experience in community engagement and program planning, implementation, and evaluation. Her primary responsibilities include assessing the needs and leveraging partner feedback to create evidence-based outreach programs, all aimed at reducing health disparities. So prior to her coming to the Indiana Poison Center 12 years ago, Deirdre also worked as a perinatal epidemiology and cancer control person. She has a BS in biology, pre-med, an MPH in maternal and child health, and an MBA in healthcare management. She's currently pursuing her DBA in healthcare administration. Deirdre is also a member of the Delta Sigma Theta sorority, and a fun fact. And so from there, with these two great experts, both leading the charge for poison centers across the country, we will dig in. I think Dr. Brown is our first presenter.
Great. Thank you, Richard. It's a pleasure to be here today to speak with everybody about child and adolescent poison exposure trends. Next slide, please. So just to give you an overview of what I hope to cover today in just 20 minutes, I could spend probably a couple hours on this topic, but I'd like to have you walk away with a sense of the scope of pediatric poisoning using multiple data sources. So we'll briefly talk about data from the National Electronic Injury Surveillance System, as well as the National Center for Health Statistics. And then we'll dive a little more into some of the emerging trends that are available through America's Poison Center's National Poison Data System. And I do want to note that I'll be referring to pediatric poisoning a lot, and most of the time I'll be referring to those that are 19 years of age and younger, but will also explain or express when we're talking about specific subcategories within pediatric poisoning. So you'll see just some changes along the way when we talk about 0 to 5 or 6 to 12 or 13 to 19. I will clarify that. Next slide. So I'd like to just start off by pointing out the top 10 causes of non-fatal injuries that are treated in emergency department. So these data are from the National Electronic Injury Surveillance System, or NICE as I'll refer to it for the rest of the presentation. So these data are from a sampling of emergency departments across the country, and then they are statistically extrapolated to estimate the number of non-fatal injuries. So what I'd like to point out here is that you can see unintentional poisoning goes across all these different age ranges in the top 10 leading causes. We also, in the older age range of 15 to 19, you start to see the self-harm poisoning creep in. And then you'll notice that, you don't see any of those gray boxes in the 5 to 9 or 10 to 14, but I like to highlight that there's also unintentional bites, or stings, or unintentional foreign body exposures. And these are also things that poison centers deal with. So I want to highlight them as we continue to discuss the scope of poisoning, because when we refer to poison center data, we encompass, that unintentional poisoning from drugs, household substances, a bite, sting, or a foreign body or toy. So next slide. And then these are the causes of fatal injury in pediatrics. And again, the time frame for these data are from 2019 through 2021. Those are the most recent available data years that I was able to obtain. So this data is a little different, not from NICE, but is from the National Center for Health Statistics. So these are typically going to be from death certificate data. And you can see that drug poisoning was the third leading cause for fatal injury in pediatrics, 0 to 19 during that 2-year time frame. So we're really framing up that poisoning is an important cause or a leading cause of morbidity and mortality in pediatrics. Next slide. And then shifting gears back to data from NICE. So this is actually an excerpt from the 2023 annual report on pediatric poisoning, fatalities, and injuries that is published by the Consumer Product Safety Commission. 2024 was actually released after I submitted these slides for review, so I wasn't able to update them with the most recent information. But again, the most recent data year that was analyzed for this annual report in 2023 were the 2021 NICE data. And as you can see here, there were an estimate of 62,000 children treated for poisoning in the emergency department in 2021, according to NICE. And that was an increase in injuries from 2020, by about 1,000. And you can see here, this report only focuses on the 0 to 5 age range, and that's important to highlight too, as we go through and look at other data sources. The most common products that were involved in these emergency department visits were things you would find around the house, right? Blood pressure medications that a parent or a guardian may be taking. Also acetaminophen, right? Common over-the-counter analgesic. And then you can also see some household products as well. So it's important to note that these exclude adverse reactions or therapeutic errors, which when we talk about poison center data, those will be included in the unintentional category that we speak about when we're talking about the 0 to 5 age range. Next slide. And then from the same report in 2023, there were 59 fatalities involving unintentional pediatric poisoning in 2021. And so that was an increase, and they had children that were less than 1 year of age had the largest increase in death rate at 7.29 deaths per million. And you can see here some of the leading causes. These classifications are based on ICD-10 codes, and you can see narcotics and psychodyspeptics. we're one of the leading categories. So that would be things like your opioid category, which you'll see reflected in other data sources as we go through the presentation. And then another leading cause was other non-specified drugs. So again, just a holistic picture of what the death certificate data represent for fatal pediatric poisoning as recent as 2021. Next slide. So now we'll transition gears into my area of expertise with the National Poison Data System, where we'll be able to look at some more recent data as it's a near real-time poison exposure database. So we'll be able to show some more up-to-date statistics. Next slide. And to give some context for the National Poison Data System, I'd like to introduce you to those who may be unfamiliar or unacquainted with America's Poison Centers. So America's Poison Centers is the association that represents all 55 poison centers in the United States. And those 55 poison centers serve all 50 states and US territories. They provide free advice 24/7, 365 through the National Poison Helpline, as well as online at poisonhelp.org. And the advice is given by our poison center staff who are experts. So we have our specialists in poison information who are the primary people that are responding to the phone calls. And these are specialists in poison information who are typically healthcare professionals, either nurses or pharmacists who have additional training and expertise in toxicology and are certified as specialists after a number of exposures that they manage and experience. And there are also poison information providers who practice under the supervision of our SPIs. And we also have medical and clinical toxicologists that really run the poison centers and establish their medical treatment guidelines. And we also have educators and epidemiologists who do a lot of outreach and public education efforts. So with this great network of poison centers, the America's Poison Centers maintains the National Poison Data System that receives data from all of these poison centers. Next slide. So the National Poison Data System is a nationwide repository of exposure and information cases. So at this point, we have about 40 years of data collection. So we have an immense repository of case records representing about over 77 million cases. And while that's great that we have this trove of exposure and information cases, we're also able to surveil poison exposures in the United States in near real time, as our poison centers that receive the cases from the public or healthcare providers or first responders, when they manage that case and document the case in their system at their poison center, once those cases are saved, they're automatically uploaded in near real time to the National Poison Data System, with the median time in 2023 being just under 5 minutes. And so all of these cases have standardized, coded, and defined fields that make it so we can set surveillance algorithms and we can monitor trends and analyze these data to see what's occurring nationally. And we also have about 500,000 substances in our product database, so we can really see product level information that's quite granular, so that way we can affect positive public health impact. And today, when we talk about a lot of the substances, we'll be referring to them in their broader categories for the sake of analysis and interpretation. Next slide. So to give you the broad overview of pediatric exposures reported to US poison centers, these cases comprise of about a little over 1 million exposure cases annually. And so when we say exposure, what we're referring to is someone suspects or has been confirmed to have been in contact with a potentially toxic substance. So they could have potentially ingested it, got it on their skin. It doesn't always result in an overdose or poisoning per se. And we also have about over 2 million exposure cases annually for adult and pediatric combined. So just to put that into perspective for everyone, a lot of cases poison centers receive are related to that 0 to 19 age range. Of those cases, about 22% of these are evaluated in a healthcare facility. So that means that the patient was either at the healthcare facility at the time the poison center was contacted, or the poison center had referred the patient to the healthcare facility for further management. About 75% of these pediatric cases are able to be managed at home with treatment advice and follow-up from our specialists in poison information. And then less than 1% of cases reported to poison centers result in a major effect or death. And what we mean when we say major effect is that without treatment, the exposure would have been life-threatening and possibly could have resulted in serious disfigurement or permanent disability. Next slide. And one thing I'll note that I forgot to mention is all of these cases are voluntarily reported to poison centers. So the cases that we're going to see displayed don't represent the whole incidence of every poisoning or exposure that occurs in the United States, but is a really strong signal for trends that are emerging in pediatric poisoning or exposure trends overall. So just a high-level overview of that 0 to 19 age range. So you can see here that we've had for total pediatric exposures, we've had a slight decrease over time with a recent increase from 2022 to 2023. And what you can see really driving some of these changes is down here between 2021 and 2022, that 0 to 5 age range had a pretty substantial decrease in cases, while our 6 to 19-year-old age range had a pretty substantial increase, and then a modest increase between 2022 and 2023. And you'll also look over here at the broad reason for exposure with the data year 2023 on the outside, 2021 on the inside. We've had relatively consistent reasons for exposure. No big changes there, where most of our exposures in this age range are unintentional in nature, meaning they're exploratory or therapeutic errors. And in the most recent data year, we've seen just a slight increase in those unintentional exposures related to those therapeutic errors. Next slide. All right. And then here we have our substance categories and reason for exposure by age. What I'd like to highlight here is in our 0 to 5 year age range, you can see we have some non-pharmaceutical products like household cleaning products or cosmetic and personal care products, as these are relatively available in the home and children can access them with ease just because they're being used or left out. And then other things like analgesics are pretty common, so the over-the-counter ones specifically. And then this dietary supplements and herbal homeopathic category tends to be related to melatonin. That's been a pretty hot topic amongst this age range in recent years. And then you can see as you get older, the exposure categories change, right? The 6 to 12 age range, we start to see some stimulants and street drugs, which is referring to substances that are used to manage, ADHD typically. So you're going to see things like methylphenidate or amphetamine salts in this category from unintentional therapeutic errors. And then our 13 to 19 age range, you can see just all pharmaceuticals here, right? And you can also see the big difference in reason for exposure based on intentionality. So important to point out that in this 13 to 19 year age range, we see almost 60% of cases are a result of an intentional exposure being self-harm, abuse, or misuse. Next slide. And then for fatalities reported to US poison centers, you can see this top line here represents the 6 to 19 age range category, and the green is the 0 to 5. And you can see that we've had overall a slight decline from 2021 through 2023, but more patients in that 6 to 19 age range having fatal outcomes due to the intentionality of the exposure. And you can see the top 5 substance categories here. So non-prescription fentanyl, which we've also been seeing from recent studies done by poison centers, is becoming increasingly a problem in pediatric patients. Next slide. All right, so we'll touch briefly on some emerging topics. Next slide. So our trends in the top 10 substance categories for 0 to 5, we'll just highlight here. There's a lot going on in this graph, so I'll orient you briefly. The dark blue is 2023, the red is 2021. So if we look across all of these substance categories, what really stuck out to me when looking at this was we had a pretty big increase from the previous years, specifically in the foreign bodies, toys, or miscellaneous category. Next slide. And when we looked into that more, what we saw was this emerging trend with water bead exposures. So water beads are often used for, sensory stimulation and growth and development with children, but they're also potentially very harmful if a child accidentally ingests them or puts them into, their nasal cavity, their ear canal, any number of places. So what we saw when we zoomed in on these data were that between 2021 and 2023, we had an increase in about 383% of these exposures. And that also correlated to a 10% increase in cases that were evaluated at a healthcare facility. And the issue with water beads is that they're so small when they're not swelled with water that they can be really hard to find on the floor. So you may not know a child has ingested one of these until they're having severe symptoms and complications that could cause things like life-threatening bowel obstructions that require surgical intervention. So this is something that we've been paying more attention to and trying to educate our poison centers on how to manage these cases and make sure that if kids come into contact, that they're safe and don't suffer severe harm from them. Next slide. And then edible cannabis, that's something that we've been seeing increase since we've had more legalization and availability of edible cannabis across the country. So this is for all pediatrics. We've seen a large increase. You can see from 2021 to 2023 that we had about a 65% increase in cases, and about 80% of these patients are managed in a healthcare facility. So that's a large burden and potentially is causing some more severe symptoms in children who are exposed to these cannabis products. And you can see it's pretty evenly split amongst the smaller age ranges. So it's not just the 0 to 5-year-olds accidentally eating gummies. It's also that 6 to 19 age range category. So this is something as well that when Deirdre talks about prevention and education, we're able to take some of these data and translate that into help with prevention and management of exposures. Next slide. Then I did want to point out the intentional exposure trends that we see. So with our pediatric cases that are intentional in nature, we have seen a decrease in self-harm cases. During the COVID pandemic, we definitely saw a large spike in adolescent self-harm. And we've been seeing that start to normalize back closer to pre-pandemic levels after in 2023. But if you'll notice here, we have seen a slight increase in abuse cases and misuse cases. So we're seeing more contacts to Poison Center about children that are abusing substances or misusing substances intentionally. Next slide. And then I'll just briefly touch on the substances that are most commonly seen in self-harm. And what I really want to point out with this slide is that the substances that are most commonly seen in self-harm are also tend to be associated with substances that can cause major effect or death. So the over-the-counter products that we tend to think of as being innocuous are often involved in self-harm exposures in pediatrics and can still cause major effect or death, especially in cases like acetaminophen or diphenhydramine. And it's also important to note that we see a lot of medications that may be used to manage psychiatric conditions or depression or anxiety. And these may be medications that a child is taking. So it's important to recognize that while we're managing some of these patients' symptoms and they're on these medications, they're still at risk for having self-harm and using these substances to cause self-harm, and they can have serious consequences from that as well. Next page, or next slide. And then I'd just like to touch real briefly on the influence of social media on poison exposures. I put challenges in quotation marks because I think that social media also presents just a lot of challenges in general for poison exposures, not just from people encouraging kids or teenagers to take a bunch of Benadryl and see if they can and put it on their social media feed to see what effects they have, or cinnamon and nutmeg or Tide Pods. But we're also seeing things that people are touting, to use boric acid for a lot of things, or the sensationalization of NyQuil chicken, where we may not always see children exposing themselves or making NyQuil chicken, but these ideas are being put out there, and children and adolescents are being exposed to them, and it does put them at a risk. And I'd also like to highlight here, this image you'll see is looking at falsified products. So you'll see the authentic oxycodone and fake oxycodone that contains fentanyl. Social media also presents opportunities for adolescents to potentially access illicit drugs, which can have even more consequences than historically just due to the fentanyl in these products. So being aware of that is also important as we think about education and prevention. And next slide. Great. I'll pass it on from here. Thank you.
Okay, and reminder to folks, put your questions in the Q&A box, and we'll collect those and get to as many of them as we can towards the end. It is my privilege next to introduce Deirdre George Davis from the Indiana Poison Center. And again, our two great speakers today from Poison Center World, their bios are on the registration website if you want to kind of look through them. They're impressive bios. So let me send it to Deirdre.
Thank you, Richard. So next slide, please. I have nothing to disclose. Next slide. So Kate gave us a lot of data, but now what do we do with it? So the best answer to that is to conduct a needs assessment. And the needs assessment is your opportunity to not only gather your data, which is essential to your program planning and evaluation, but it helps you get to know your demographic a little bit, who's underserved, why they're not using your service, and what to do. So, and that can be done in a number of ways. You can do focus groups, pre and post tests, underutilization studies. As long as you're gathering data, you're assessing the need of your demographic. Specifically to Indiana, we actually just finished our underutilization study based on call data, and that is what is serving as the foundation of our current needs assessment. Next slide. So just a little specific data for Indiana adolescents. Most calls to the Poison Center in the last 5 years showed us that exposures in adolescents were intentional, as Kate alluded to. And this means exactly what it says, that it wasn't an accident, but it doesn't necessarily mean that it was a suicide attempt. Intentional could have been a schoolyard or social media dare, a drinking game. Maybe they intentionally ingested an edible. Intentional is really broad. So next slide, please. When we dig deeper into Indiana data, we do actually see that most of our intentional ingestions were suspected suicides. And also keep in mind, this is very specific to Indiana adolescents 10 to 19. So, excuse me, as you can see, though, it did take a huge spike during the pandemic, and now we are actually trending down. So adolescents are getting back to their usual behavior. They're not at home, they're interacting again. Next slide. So the big question is, how do we prepare ourselves to reach out to youth and to their parents? Well, first and foremost, as an educator, we attend a lot of conferences and do extensive professional development. That may be through our host institutions, strategic partners, and we also attend a big conference every fall. Second, we set up trainings via in-person or online. Many centers have statewide or multi-state service areas and have developed training programs that mimic train-the-trainer models. Most, if not all, centers have strategic partners that help reach their target demographic. So that's where that train-the-trainer model comes in handy. Finally, most centers maintain an active web presence, and this looks different for most centers. It just depends on multiple factors: staffing, host institution capability, target audiences, and I'll talk a little bit about Indiana web presence a little bit later in my presentation. Next slide. So on a national level, we have the Educator Advisory Committee, and that basically is every poison health educator affiliated with a poison center. And while every center may not have a full-time educator, every center does do public education and outreach. And the educators collaborate usually daily and share ideas with each other. And again, I mentioned the conference that we attend for professional development, which puts us all in the room together so that we can learn about trends in different states, how each educator is addressing that, what they're doing to set up programs, how they're conducting their needs assessment. So there's a ton of collaboration that goes on at that meeting. Second, the Content Development Committee was developed in 2019. Educators were looking for ways to find consistency in their messaging as we move towards this idea of national branding. And we reached out to the central office for assistance. Myself and two other educators attended a 2-day-long meeting to decide what that would look like. And while members of that committee have changed, educators are still surveyed every year on content that we would like developed. Excuse me. And this committee is also instrumental in putting together partner toolkits. Finally, we have the National Poison Prevention Week poster and video contest, and this is hosted by the MPPW Council, on which APC is represented. And this actually gives youth a voice in poison prevention. So elementary kids participate in the poster contest, and then secondary, which is middle and high school kids, participate in the video contest. They're judged by various stakeholders, and winners actually get a cash prize. So reach out to your local poison center to see if they participate in that. Next slide. So now we're going to look at a few of the campaigns that have been developed by the Content Development Committee. This was our first lookalike campaign. Lookalikes are always a big discussion among educators, but in this, we were looking for consistent messaging. So what you'll see throughout all of this is we talk about keeping products in original containers, reminding caregivers that child resistant is not child proof. Given enough time, children will find access to what it is they want access to. Keeping products up, away, and out of sight comes through our partnership with Safe Kids. But we also tell parents to keep things locked up if they are able to. And the intention behind this campaign was to replace a poster that had been around for a few years. And while we did replace the main poster, which is what you see in the middle, we created the mini posters to kind of target each topic. Next slide. And as time moved on, that topic list, of course, increased and our campaign evolved. So while lookalikes remain a consistent part of our messages, many centers, including mine, have created lookalike displays or lookalike boxes that they take out into the community, and those look different, just based on what that educator is talking about for that presentation. When I personally present to students, I have slides that show two different products, and I ask them which one can be harmful and which one do they think is safe. Many poison centers, along with their strategic partners, have been pushing to change packaging, particularly in cannabis products, because we have products that might say Skittles, but they're actually have THC in them. So we want to make sure that when your child is eating Skittles, they're actually eating Skittles and not a cannabis product with near identical packaging. Next slide. So another thing we also do is come up with seasonal campaigns. These are just examples of a few of them: Halloween, spring, spring break, Christmas, and of course, carbon monoxide. So while carbon monoxide isn't a season, it's a seasonal topic. So we dove in a little bit deeper with that beyond our winter hazards campaign. So typically, the content development committee will come up with something that is relevant for the time and the audience. Next slide. So as Kate mentioned, the majority of our calls to poison centers are about ingestions in children 5 or younger. Many years ago, we had a poster called The Poison Purse, and it showed all the dangers that were lurking in a purse. But let's face it, purses aren't the only bags that have hidden dangers. So the next campaign, which isn't shown, was a briefcase. And then now we have this, excuse me, this campaign, which is what we are calling our pediatric campaign. So in this campaign, you're seeing, could you be carrying poison? But then the next thing in our messaging that all educators should be sharing is that, number one, you should save the number in your phone, and number two, you should share that number, particularly with people who have children in their care. But more so, that poison centers should be your first call. As Kate mentioned, 75% of our cases are handled at home. So calling a poison center could save you the time and expense of an ER visit. And I think we have a poll question. Okay, here we go. So in 2020, which month had the highest number of pediatric calls? I think we'll give that a few more seconds. Okay, and launch. Yep. So most people said January, but in 2020, the most we saw in Indiana was March. And you can imagine that was when people were the world was shutting down. Kids were sent home from school. College kids were sent home. So it's actually March. And then one more poll question. So in 2022, and again, I'm sorry, I didn't mention this. This is specific to Indiana. Which month had the highest number of pediatric calls in 2022? Okay, so let's see. In this September, you are correct. And the theory is that the world was opening up, kids were going back to school, they were trying new things, lots of different things were going on in September of 2022. Okay, next slide. So when the pandemic hit, everyone thought staying at home would save lives, right? And while it did, it also put others at risk due to isolation. a group of educators actually formed a suicide prevention task force. And out of that came a suicide prevention toolkit. And I'm not sure, we might have to click again. It looks like that entire slide didn't load. There we go. Came a prevention toolkit, and it had messaging, graphics, and it was in direct alignment with the messaging of the 988 Suicide and Crisis Lifeline. So some key points that came out of that. There are 5 steps that you should always take when you encounter somebody in crisis, and that's ask, are you thinking about harming yourself? There is no harm in asking that question. Be there. So if you're going to ask that question, make sure you're going to listen and listen attentively and hear what it is that person is feeling and saying. Keep them safe. So remove harmful items from the home or from their direct environment. Put them in touch with resources, and then follow up. Don't just leave them hanging. If you're going to go down that road with them, make sure you stay with them through the end. Next slide. So you've heard us talk about National Poison Prevention Week. It's always the 3rd full week of March, so that was last week. And how each center approaches it may be different. Some do huge social media pushes, some do mass mailings, others set up community presentations, some have PSAs and media spots, but in most cases, it's a healthy combination of all of the above. This is a look at some of the campaigns that our content development team came up with. And it takes us back to what I said earlier, the consistent messaging. We want to make sure that even though we're 55 different centers, we have consistent messaging across the board. So if you would like a Poison Center toolkit, just reach out to your local Poison Center and they can provide you with the link to that. Next slide. So there's also an MPPW committee of educators, and we create activities for kids and parents during National Poison Prevention Week. So here are examples of some of the stuff that we've done. I've already told you about the poster and video contest. We do a daily Wordle. We've hosted virtual escape rooms. We've done Kahoots. We've done virtual story time, created Mad Libs. And just the bottom left of the screen, you can see actually our poster contest winner for 2024. Next slide. So now about Indiana, what are we doing here? Most recently, we've started sponsoring community events. It gets the name out, it gets the logo out, and it gets messages to a broader audience. We conduct trainings similar to what I mentioned before. So if you're interested in having your staff trained, reach out to your local Poison Center. We attend educational conferences and community fairs. And that could look different in a multitude of ways. We could be presenting, we could just be providing resources, or we could be a vendor. Our medical director hosts Tox Talks, in which he talks about case management and trends in data. And then more recently, we have started doing lunch and learns. And the Lunch and Learn is basically a comprehensive slide deck that can be tweaked depending on who your audience is. It gives attendees an overview of who we are, what we do, and why that work is important. Next slide. So the things that I spoke about earlier, just letting you know what Indiana does. We have a very active web presence through our website, and we're on most of the social media platforms. We just dove into TikTok, so that should be heading up soon. We do community presentations in schools, churches, businesses, and community organizations. And we also do targeted mass mailings and media requests. There's a QR code. If you're looking for materials, just feel free to scan and it'll take you right to our material request page. Next slide. So in terms of partnerships, these are some partnerships that the state of Indiana has. If you'll notice, two of them have asterisks next to them. Those are partnerships where we have direct outreach to youth. So in Wayne Township, we actually go and participate in the Risk Watch program, which is fire safety, CPR, and poison prevention. College Mentors for Kids, we partner with them. They have college kids who mentor school age kids. And so it's kind of a 2-for-1 where we get to give poison outreach to both the college kids, and then those college kids can send that poison message, deliver that poison message to school age kids. Next slide. So I said before that we always ask people to save our number. So I'm going to give everyone a call to action to scan the QR code and save the Poison Help number in your phone before we end. And I'll give you about 30 seconds to do that. Or maybe 15, depending on time. Next slide. And that is my contact information if you have any questions.
Great, thank you, Deirdre. This is a very current topic, Deirdre. That was fantastic. And Dr. Brown, with some really strong experts, we have a lot of questions coming in. So we'll try to get to as many of them as we can in the 60-minute slot we have. And then obviously also happy to do follow-ups. So I'll just kind of take them as they go here. And first one is, what are some good prevention ideas? How can we help? When we talk about the ingestion of poison, does that include marijuana, especially now that it's legal? Who wants to grab that one?
I can speak to the ingestion component of, cannabis. So that is certainly, like touched on in the presentation, we see that increase in edible cannabis exposure. And we know that part of that is due to differing packaging requirements throughout the country, because there's no uniform regulation on how you package edible products. So I would advocate for people involved in, poisoning prevention experts, especially tailored toward cannabis, advocate to not have packages that can mimic real food products, like the Skittles that aren't Skittles, that have cannabis in them, and also advocate for child-resistant packaging for any sort of cannabis product, period. Deirdre, I don't know if you have any additional insight to add.
You said exactly what I was going to say.
Okay. Next, are you seeing an increase in vaping-related poisoning?
So as far as vaping-related exposures go, we do have some data recently showing that we have had an increase overall in these types of exposures. And it's interesting because early on it was the liquid that was sold in containers that people could, excuse. Richard, would you do another question? We'll recircle to that one.
Sure. So Deirdre, please include tips related to effective conversation with youth and teens about social media challenges, TikTok, Snapchat, etc.
So the first thing you have to do is actually be willing to have that courageous conversation. And a lot of that involves listening without judgment. So you need to be able to approach the conversation with information, and there's plenty of information both in with Poison Center resources and then through the 988 helpline. But first, you have to be willing to have that conversation. Then you need to be willing to address the dangers and have some real what am I trying to say? Real actual events that have happened, or just things that are not just potential. hypothetically, this could happen. Rather than hypotheticals, speak to them in the real, speak to them in the now, give them real-time examples of things that are happening on social media, and encourage them to be leaders and to not follow the social media challenges and we were talking about the chicken, let's have chicken the normal way, not with NyQuil.
There's a related question about parents who vape, right? And how do you talk to those parents, and how do you kind of prevent the accidental ingestion when you have parents vaping in the house?
So that partially goes to keeping things up, away, and out of sight. A curious mind is going to dig into what they see. And we know that kids move really fast. So you could step away for a second, and the next thing you know, that vape canister is open. So from an educator perspective, we encourage parents to keep that stuff locked up. If you don't have a lock, many poison centers have cabinet locks that they will give you, or to keep it up, away, and out of sight, as we do with all medication, prescription, and over the counter.
And I'll add to that, Richard, just circling back after I was interrupted, that the increase that we're seeing, right, we were initially seeing this increase in exposures to the liquid that people may put in refillable vape devices. And now with the market expanded for disposable vapes, we have definitely seen an increase in pediatric exposures to those disposable vape products. So that's certainly a shift in trends that we're seeing related to vaping, that the cartridges, the disposable pens are inadvertently, children are being exposed to.
Okay, next up, what types of foreign bodies are considered something that would poison besides Tide Pods?
Yeah, I could take that question. So the foreign bodies that we're referring to in our data system and our hierarchy actually don't include Tide Pods or laundry detergent pods at all. They're in their own little silo. So the foreign bodies we're really referring to here are typically going to be sorts of toys. So it could be any toy. As you can imagine, the public will contact a poison center if their child has ingested just about anything, because they don't know if the paint on the product is a concern to them, if there's anything else they should be worried about beyond the choking hazard, right? So we'll get contacts about a lot of toys, but then the important foreign bodies we think of are magnets, right? Magnets are a hazard for children, especially if they ingest more than one. Button batteries or disc batteries are also a huge concern, and a foreign body that would be ingested by a child potentially that would prompt a contact to a poison center. So we do have a scope of products that are captured there, and they have varying degrees of issues they can cause, from just a choking hazard to potential esophageal burns or bowel obstruction, like with water beads. So that's kind of what we're thinking of. It can be like an atypical poisoning, if you want to think of it that way.
Great. Okay, next up, what would be an example of an intentional poisoning in the 6-year-old age group?
So one of the things between 6 to 12 or 6 to 13, we have seen some increasing self-harm behavior in younger children. So unfortunately, down to that like 10-year-old age range, that's something we have been seeing in recent years, are younger children having an intentional exposure. As far as a 6-year-old having an intentional exposure, that's a little less common, but at that age, if they are developmentally on track, you could potentially have some intentional misuse of a product when maybe the 6-year-old should know better. So maybe they take gummy vitamins every day and they know they're not supposed to eat them because they're medicine and not candy, but they intentionally eat it because they wanted to enjoy it. And they should, at that point, really know better. So that's on one spectrum, not self-harm, but just how a 6-year-old may be categorized as an intentional exposure.
Right. And I think these were posted, Deirdre, some of these are posted. It says, do you have or can you link any specific handouts for families that can be distributed in at least English and Spanish?
So in Indiana, yes, we do have handouts. The link, I believe, was placed in the chat. But Indiana has all of our handouts are, there it goes right there. All of our handouts are in English and Spanish, and we have started to translate a few of them into 2 different Burmese dialects.
Great. Okay. Let's see. Vaping seems to be a hot topic, so people want to know if there's an increase in vaping, vape product poisonings. I think we've addressed that. That's a yes, right? So more general question, which category of toys are harmful? Are you referring to small toys or large toys that have lead or harmful toxins? Is there a difference?
So when we're talking about foreign bodies, we just kind of address that where there's that varying spectrum of harm. So for example, we're talking about both small toys and large toys in that category. And sometimes it may be a piece of a large toy that a child ingests. And, all the time we have to try and assess if there is risk for things like lead poisoning. Was the product imported and could potentially contain contaminated paint, right? Or we have to consider that there are products or toys that call themselves non-toxic, and we have to recognize that nobody regulates putting non-toxic on a label. So something like, a water bead, we don't always know what the composition of the inside of that water bead could be. So there's just that varying degree of potential harm from foreign bodies, which makes them, a challenging category of substances to really generalize. And we do track, I see a lot of lead poisoning questions coming through. Poison centers do track exposure to lead products or lead poisoning in general. Not every case is confirmed, but we do have a category for lead specifically as a metal that we track. And I didn't display specific data related to lead poisoning in pediatrics today.
Great. So yeah, a couple lead poisonings, and again, a more general question, are there specifics related to where in the country, meaning between rural, frontier, urban, what kind of poisonings you see there?
So in our case, we actually just finished as I mentioned, our underutilization study. And we do see that in rural areas, our services aren't being used as much as in urban areas. But as I mentioned, we just finished that study. So we are in the process of seeing how we're going to use that data and what type of outreach is warranted to those types of communities. But it's just a matter of diving in, and we have a few ideas, but we haven't executed them yet. But we are seeing that there are differences between urban use of poison center services and rural.
And then another question on button batteries. One, just a quick review of kind of the places where we see button batteries and where we do not. I think the example given on the question is like musical cards, those kinds of things. I don't know if you guys have any experience on that front.
Yes, button batteries lurk in a lot of things that we don't always think about. One of the newer ones that I hadn't thought about as much are like key fobs, with, cars being more common that don't have a traditional key but have a fob. That's an item that contains button batteries. There are toys that contain button batteries, like clothes or jewelry that maybe light up may have button batteries in them. So they really are in a lot of places, and it's not always obvious. So it's always encouraged that when, parents are giving their child a new toy or something that has some electric or electronic capacity to it, really making sure that there isn't a button battery in it and they're not going to be with it unsupervised, if that's the case there. So they are in a lot of different things.
Okay. We are coming up on the hour. I just wanted to Really thank both Kate and Deirdre and everyone who took the time to attend today, to ask questions and to engage. It's a really important topic, and the data comes in live, and you have two experts here who are on the front lines of doing this every day. So it's a privilege to work with them both. Any questions we didn't get to, we're happy to follow up. Please take a moment, if you would, to complete the survey. That's really important. We value the feedback. And again, from America's Poison Centers and from the Children's Safety Network and HRSA, we really appreciate the time to have this conversation with you today. A lot of lives to be saved and a lot of work we can do. So thank you. Thank you to Deirdre and thank you to Kate.